All right, Amanda, thanks so much for being here. My first
Yes.
question that I have for you is tell the audience a little bit about yourself and how you got started to where you are today.
So I'm a board certified behavior analyst, and I originally started off with a fascination in psychology. So I come to the field of ABA from a psychology background, and I stumbled across ABA when I was finishing up my master's degree in psychology and was trying to figure out, okay, do I go licensed mental health counselor or do I go for my PhD? And I went to visit an autism clinic and absolutely fell in love with the proactive approach. And so very quickly added that specialization onto my master's degree and ended up as a BCBA.
hmm So tell me what goes into being a behavioral analyst. How is that different from like the mental health aspect of things?
So, a behavior analyst, our goal is we work with behaviors only, observable behaviors mostly. Now, we have evolved in our field to start to realize what we call private events. Those are emotions because they're not readily always you can't see those necessarily on the outside. However, there is an interpretation on an individual's face, typically of an emotion. However, that can be subjective. So we work with observable behaviors, and our goal um, in the field of ABA that works primarily with children diagnosed with autism is to help that child or young adult make the gains that would make them as independent as possible in their daily lives. Now, ABA has grown so much since I started. I've been a BCBA for 12 years, but been in mental health for over 20. So, mental health, then on the other side, is more talking out feelings, talking about traumatic events, and kind of setting up processes under different umbrellas of mental health, like cognitive behavioral therapy or dialectical behavioral therapy. There's a couple of different talk therapy types of models out there, but ABA is more action based. It's like, okay, what are the steps that we can take to get you to where your end goal is? And like I mentioned, ABA has grown so much over the years that we now utilize, it's been around for many years, but acceptance and commitment therapy. And I use
hmm
that a lot with my older kiddos or my kiddos that are maybe more diagnosed outside of the developmental disability realm. And I use it with my parents that I work with for parent training. Full disclosure, I use it on myself too. So ABA, acceptance and commitment therapy. Those they're all good things that can help most anyone in their daily life. But because of the progress that we've made in our field, we are able now to help individuals working with a variety of different life issues, whether it's fitness goals, goodness, health journeys. There's a lot organizational behavioral management. There's a lot of emerging fields within ABA right now. So it's while insurance has pigeonholed us into developmental disabilities, it's a broader field. It's so much more than that. And that's, to me, the most exciting part about ABA versus just a talk therapist, which they have a space in our field as far as in the mental health realm where I think that they are very needed. But I prefer ABA just because it's more action based.
hmm And since it's more action-based, and that you work with a variety of that it's very broad. So what does that sort of look like? How do you as a therapist sort of um what sort of client populations do you work with, and how do you sort of work them through that, help them through that?
Yeah, so right now, and most of my career has been spent working with children and young adults. I would say mostly 21 and down. I would say my niche is probably about 16 down to about 18 months old. That's where I've spent most of my career is in adolescence and early childhood. And really, it all starts out with coming to the individual, if they are verbal and can speak, and saying, if I had a magic wand, what is the one thing that I could do in your life to help you today? And if the child or individual is not verbal, it's speaking with their care providers and really kind of asking the same question. Now, I don't have a magic wand. I cannot, just wave a magic wand and make life better. But that's the question to me that gets down to like the meat of what someone is really seeking help with, or where a family is maybe seeking help. And I love the family collaboration component. In fact, as I grow as a behavior analyst, I see the importance for that parent caregiver collaboration component for the younger children to really help the family unit get involved, rally behind this individual, but be on the same page with the individual as they grow for their needs to be met.
Hmm. What is it like working with individuals 21 and down, with that population in particular? Because I've talked to other mental health therapists, and I talked to one that was working with older adults, and she was like, if I work with like younger kids, I'm like, nope, like I can't do it.
So I love young kids. I love adolescents. I would say that I call them squirrely adolescents, that are just feisty, going through normal teenage things. I love that. They have so much joy that they bring. Yes, they have struggles, but there's so much joy. Little kids are they're funny. They're just brutally honest. They, if I've ever have a blemish, they're the first ones to point it out. They always say, Miss Manda, what's that? Or they're just cute. And they really are just, seeking that. A lot of kids just want that place where they can feel like themselves, that place that they can learn the skills that they need, and that place where they just feel welcomed and accepted. And I love that I can be that place for families and for children. And I just love the things that come out of kids' mouths. I also love the tremendous successes that I see with children. Um, One of the very biggest but early success, I was working with a kiddo, to kind of, his mom just said, I just want to hear him say, I love you, mom. And so we would practice, and I would implement, a lot of techniques. And there was a day that he paused and he just sat there, and I was like getting ready to see if he was going to like possibly error. And he just looks at me and says, I love you, Manas. And that melted my heart. And I have
Hmm.
had so many of those sweet, happy moments over the years. Do kids have a lot of energy? Absolutely. I typically
Hmm.
have a good amount of energy to match them. But I just love what comes with kids. And then if you get like an angsty, squirrely teenager, there's just still so much joy in working with kids. Now, I have worked completing assessments all the way up through age 45, and that was a little harder for me, only because at that age, parents or caregivers are looking possibly for some different placement options. And goodness, it's hard for me to know that if somebody had come along so much earlier, if our field had been accepted so much earlier than it was, then this person may not be at 45 looking for some type, parents or caregivers may not be looking for, long-term placement. However, sometimes long-term placement is the better scenario, because it can be very isolating to be an individual with a disability. at an older age, and sometimes those scenarios, if it's the right fit, and parents, caregivers, or and the individual work together, um, can open up a social outlet for them again, which they might not have in the home environment if depending on what is going on with the family and how they can support their loved one.
What's it like working with the parents of those kiddos and the caregivers?
Wonderful. It is, let's see, it can be. I have a very unique perspective. I'm personally a mom myself, which is not unique to BCBAs. There's a lot of parents that are BCBAs, but I have three children, and all have had varying needs. And realizing that one size does not fit all. And so I take that approach, and that on my hardest day as a parent, can be that's, or my hardest day at work, that's somebody's everyday life. So I never have what
Hmm.
I call a hard day at work, because I recognize that that is someone's everyday life. So I come to them hopefully humbled and open, and say, how can I help you and your family? And I really work to meet parents where they're at on their journey. Every parent, I've come across, parents that are newly diagnosed. I've come across parents that are more seasoned and they've been through ABA for many, many years. I've come across parents who have had great BCBAs. Some have had horrible BCBAs. So I come across parents with varying experiences, and I just ask them, please know that I come to you, and we're going to start, a relationship. And my job is to help you find the best path forward for your child and what you think that that path is. And then I try to structure it, of course, with developmental guidelines and things that I know will help somebody reach. But I come to parents very humbled. One, I feel extremely privileged that they've allowed me the opportunity to work with their family, and that they're sharing their loved one with me and looking to me for guidance. And then two, as a parent myself, I understand those hard days. I think most parents do. There are hard days
Hmm.
out there. And knowing that if I could bring just an ounce of relief to that really hard day that someone may be experiencing every day, then I know that we can make progress moving forward in helping them advocate or better understand or learn the skills behind ABA and why we're so successful, so they can feel more empowered in their family members' journey.
Mm-hmm. Because I was gonna ask is what have you learned in doing this kind of work as an ABA, ABA professional? Because you also have not just your title as an ABA person, but you also have a kid. You're a parent of kids with other needs. So,
Yes, I've learned to stay curious. I've learned never be overconfident, never go in assuming like I have this, never assume that parents aren't just meeting the needs of their children. Because some people will, say, well, if they just did this and this, and I'm like, well, no, parents, yes, there's some not so great parents out there, but for the most part, I've been blessed to work with so many great parents that they're doing the best they can with the
hmm.
information that they have. And so it has humbled me, but also made me strive to do better as a professional, to really find the evolving needs of a parent. And I can say, having gone through the COVID timeframe, I had a lot of parents that in my early years that were so hands-on, and they were there and they were involved. And then going through COVID, everyone was so overwhelmed. And
Yes.
parents were really hands off, and they were kind of like, here's my child. I cannot handle things right now. And then really kind of we worked together to kind of claw our way back together, parents and me, like, okay, how do we get back to that place before where you had the energy? Um, but knowing that, life stressors can cause parents to be able to be in the moment and then also cause parents to have to take a step back from time to time. And I've been criticized about this in my field from other professionals, but I still stand by it. And I tell parents, like, listen, I know there are good days and bad days. As a mom, I get it. There are some days that you just don't have it in you. And I'm here to tell you that I understand that and that I'm a big fan of picking and choosing your battles with your children, no matter what it is. It could be what you're eating for dinner. It could be, what clothes you're wearing. It could be anything. But I'm a big fan of if you don't have it in you, then give yourself a little bit of grace. I need you to be involved with your child. I need you to do what I'm asking and working together more often than not. But if I come to you from one week to the next, and you tell me, Amanda, it was a hard week and I just didn't have it in me. I'm going to say, okay, what can we do together to help you get back to the place of where you do have it in you? And what can we get back? How can we get back to that place? And what's happened? What's changed? And sometimes it's just listening to parents, giving them the validation that, life is hard sometimes. We don't always, sometimes we don't understand the hand that we're dealt in life, but at the end of everything, that children are such a blessing. Each individual is such a blessing. And, and so where can we get back to that where I can help you have the energy to jump back in and be super involved and be able to work through those harder times because you know that the ultimate goal for your family member will be better.
Hmm. And is there anything that you would like to work as a behavioral analyst that you're like, I'm curious about this more, or curious to learn about this a little bit more?
Oh, I do that all the time. So I would be a
Hmm.
career student if I could. So in addition to being a behavior analyst, because behavior is pretty behavior is not just human behavior. There's behavior everywhere. Like so animals
Hmm.
have behavior. There's a subset of animal behavior analysts that work specifically. Again, that's a different training, but I have gone through a can't remember, it was a year or a 15-month, I can't remember, it's been a while, a training course to be a certified dog trainer. Now it's certification through that specific company, but it was coursework to become a certified dog trainer. I love working with animals. I have 5 dogs myself that may start barking in the background in a second, and I might have to pause for a second. Um,
Yeah, thanks
but
for
because
the
I hear
heads
them
up.
I hear them kind of stirring, but I love working with animals, with dogs, and then on top of that, acceptance and commitment therapy is a huge passion of mine because I've seen the benefits that it can bring to everyday life outside of just developmental disabilities to parents. To people suffering with a variety of different things, and that prompted me to look into kind of the health related portion of ABA and actually became a 200-hour trained yoga instructor as well. Now, I don't practice, yoga. I don't teach yoga currently, but so many of the principles, as far as like some of the breathing or just thought processes, I bring into my practice. And then as well as, all the forms of therapy that I can apply behavior analytic principles and practices to that applied aspect. Not just acceptance and commitment, but what other areas can that be applied to? But my biggest focus right now has been on parent training and caregiver collaboration within the field because I do find that caregiver collaboration is just so important. And because we've been so pigeonholed into autism only or severe developmental delays only, there's so many parents out there that they just want either one validation that they're not hurting or messing up their kids. Like if I tell my child, no, you may not have ice cream tonight, that's not going to cause a traumatic event, 20
Yeah.
years from now. They just want to know that that's okay. Or
Mm-hmm.
they say like, my child won't stop jumping on the couch when, and I've told them a million times, stop jumping on the couch, and they're going to hurt themselves. So I find, and that's why I launched my platform, Limbiguous Behavioral Support. It's to reach those parents that don't meet the criteria for insurance to cover, and I wanted to get tips and tricks into everyday parents' hands, just how to make a better morning routine that kind of helps get everyone out the door a little bit less stressful. Understanding behavior. It's yes, it can be complex and intense, but it can also be sometimes very easy and simplistic. And if I can get a few tips and tricks into a parent's hands that just helps them be more confident on their parenting journey, then that's where my focus has been driven lately.
Lastly, what tips or advice would you give to those who or want to do what you're doing as an ABA professional?
Yes. So in my undergraduate, so I started out in psychology, and I had an undergraduate professor. And at that time, I had a huge deep dive into forensic psych. And I had a professor say, how many of you all want to go into forensic psychology? And of course, I raised my hand. I was like, yeah. And she's like, stop right there. None of you all are going to make it. And that was like a pivot
Wow.
point for me. And I was like, excuse me? But yes, it did lead me to the field I am now, but I would say is don't ever let anybody tell you that you can't. Don't ever stop learning. Don't ever stop being curious. Find the company that is maybe going to get you your feet in the ground first to see if you like the field. There are aspects of this field that some people get into and decide that they don't like. But second, if you do like it, then look for educational opportunities. Ask, I'm always open if anyone ever wants to email or ask me, like, hey, do you have a conference that you like or a colleague that you could refer me to? I don't work in academia, but I do have friends that do. And so don't be scared to network within that.
Mm-hmm.
And just persist and move forward. And I would also say be open-minded, because some of what you're going to learn, and what you think you are going to do as you go through the programs, and to become a behavior analyst, you're going to be challenged a little bit. Some of your thought processes are going to be challenged, and that's okay. It's all growing opportunities, but never let anyone tell you you can't. Always be a fierce advocate. If you don't have it in you to stand up for every single one of the families that you work with, then I always say, like, reevaluate that relationship and make sure you're always a fierce advocate for the well-being and the betterment of everyone you work with, and never ever stop being curious. I love when RBTs, which is a registered behavior technician, that's typically an entry position into our field. I love when they ask me why. I love when they challenge my thought process, because that just keeps me curious and keeps me learning. So don't ever let anyone tell you no, and stay curious.
Mm-hmm. All right.